Conjunctiva, bulbar, congestion, conjunctival and ciliary. Secretion, chemosis or edema or subconjunctival hemorrhage may be present. Prolactin growth, pterygium cyst or Bitot spot, vitamin A deficiency. Palpebral, the upper lid is avoided by asking the patient to look downward. A gentle pull on the eyelashes and simultaneous pressure over the skin of the upper lid by index finger or glass rod is given to avoid the upper lid. The lower palpebral conjunctiva and fornix are exposed by pulling the lower lid downward. Both upper and lower lids are examined for congestion as in conjunctivitis, follicles, papilla, foreign body concretions, scarring, for example, trachoma, chemical burn, membrane as in diphtheria, streptococcal conjunctivitis, symplepharon, adhesion of the lids to the globe, for example, chemical burn, plica semilunaris, it may be displaced by tertium growth, carbuncle, there may be inflammation or growth, cornea, in children and in marked blepharospasm, lid retractor may be used for examination after installation of local anesthetic. Size normal, vertical diameter is 11 mm and horizontal diameter is 12 mm. It is measured by the keratometer. It is small in microphthalmos. It is large in ophthalmos, megalocornea and myopia. Curvature. Normal radius of curvature is 7.8 mm. It is measured by the keratometer. It may be conical, globular, or flat. Surface. It is examined by the Placido disc, keratoscope, or window reflex. Transparency, facet ulcers, opacities, nebula, macula, leucoma may be present. Position. The situation and extent of the opacity is noted in relation to iris. Pigmentation over the opacity is seen in adherent leucoma. Any iris adhesion or anterior synechia, pannus or vascularization, striate keratitis are noted. Sensation. It is tested by touching the cornea with a wisp of cotton wool. Normally, there is a brisk reflex closure of the lids. This is known as the corneal reflex. Thickness. The thickness of the periphery of the cornea is 0.67 mm. It is 0.52 mm thick in the center. It is measured by the pachymeter. Staining of the cornea by vital stains. Fluorescence 2%. It is the most useful and commonly used vital stain. It marks the area of denuded epithelium due to abrasion, corneal ulcer, etc. It is available as drops or disposable strips. Superficial staining, a drop of fluorescence is instilled in the conjunctival sac. Excess dye is washed with normal saline after a few seconds. The lesion is stained bright or brilliant green. Deep staining. After installing the dye, the lids are kept closed for about 5 minutes. The dye penetrates the intact epithelium and any infiltration in the stroma takes up the dull grass green color. The defect in the endothelium appear as green-yellow dots. Bengal rose 1%. It is a red aniline dye. It stains the diseased or devitalized cells red. For example, as in superficial punctate keratitis and filaments. For example, keratoconjunctivitis sicca. Alcyon blue, it stains only excess mucus, for example, as in keratoconjunctivitis sicca, dry eye. Sclera. Curvature and color. There is thinning, pigmentation, and ectasia of the sclera in myopia, staphyloma, and blue sclerotics. Vessel ciliary injection and nodule is seen in episcleritic scleritis.